Okay, so welcome back, everyone. We hope you enjoyed the interactive sessions. I was really torn between the two sessions because I wanted to follow what Dr. Troats was saying, and then also, of course, what was happening in the youth panel. So the good news is you can always watch our YouTube, so you can watch back what was said, and you can still respond to that through our YouTube video channel, which is Green Heritage van Suriname. And now we will then continue with the next and basically the capstone of this conference. I'm really proud and honored to present the next speaker to you. Dr. Maureen Lichtveld holds a Master of Public Health from Johns Hopkins University and a Doctor of Medicine from the Anton de Kom University of Suriname and the Leiden University in the Netherlands. Since the 1st of January of this year, Dr. Lichtveld was appointed as the Dean of Pittsburgh Graduate School of Public Health. And I am just pausing for a second because I need to make sure that we are on. Yes, we are. So sorry, that's the technology is always very exciting. So I was saying that Dr. Lichtveld was appointed as the Dean of Pittsburgh Graduate School of Public Health since January. And she is a member of the National Academy of Medicine and has nearly 40 years of experience in environmental public health. So Dr. Lichtveld's national and global environmental health research examines the cumulative impact of chemical and non-chemical stressors on communities facing environmental health threats, disasters, including pandemics, and health disparities. Dr. Lichtveld has lectured at Tulane University for 15 years after serving 18 years with the Centers for Disease Control and Prevention and the US Department of Health and Human Services Agency for Toxic Substances and Disease Registry. At the CDC, she designed public health research tools and protocols to guide national environmental health studies in communities living near hazardous waste sites. There are many more accolades to mention, but I don't want to take up too much of the audience's time. So I will end by saying that I have enjoyed working in the past years with Dr. Lichtveld in the Mickey Tamara project. And so I would say visit the booth in the last hour that we have in this conference. And I am sure she will tell you more about what Mickey Tamara is about and why it is significant in the context of a healthy ocean and human health. And so we will have this different perspective now from a public health perspective, looking at ocean health. So thank you very much, Dr. Lichtveld, for joining us, and the floor is yours.
Monique, and I am going to share my screen. Thank you for that generous introduction, and also thank you for giving me the opportunity to actually be with you. I wanted to make sure that if someone could tell me whether you are seeing my slides. Either in a chat or some other way before I start.
But I'm going to go check on my screen.
Okay.
I think you're set. I think you're good.
So I'll go ahead and start. And Monique is right. First of all, congratulations to the organizers. And specifically congratulations to including both Suriname and Guyana in the conversation about ocean health. I want to present to you a different way to look at ocean health, through the lens of climate change, but particularly to look at ocean health through the lens of the impact of ocean health on vulnerable communities, and particularly of climate change. So today, what I promise I will do is describe the concept of planetary health, explain the relationships between planetary health, One Health, and climate change, all big words, but what do they really mean? Discuss global climate change, but especially from a regional perspective, and as I mentioned before, honing in on the vulnerability in the Caribbean region. And then lastly, discuss ocean health in the Caribbean from a climate and planetary health perspective, again, with focusing on the things that are happening in both Suriname and in Guyana, and in fact, in the Caribbean. So if we look globally from an overall perspective, and to the answer to the question, why are Caribbean communities vulnerable? Then on the outer layer of this circle, you see that we are focusing on planetary health, all that of living and all that is providing us the opportunity to live within our planet. And I'll come back to the definition much closer. Then right below that and encompassing that is climate change. And yes, we're all, including in Suriname and Guyana, dealing with the current pandemic, but we will get the pandemic under control. We'll get this virus under control if we do the public health things that we need to do, the public health actions that we need to take. But once we do that, and while we're doing that, climate change is the most significant and urgent public health threat that the global community is facing. There is no higher threat to our health than the impact of climate on our health. Right below that are the persistent environmental health threats that we're facing. And today, as Monique indicated, I'll talk a little bit about the Caribbean Consortium for Research in Environmental Occupational Health, the environmental epidemiological cohort study that we are conducting in Suriname. And then within all of that, and facing us historically, including in Suriname and Guyana, are disparities in health, but also socioeconomic disparities. And so all of that, if you imagine, if you were in that green circle, all of that is laying on top of our communities. And that's if there's nothing else that you remember from this presentation, I'd like you to think about the burden of our community of each of these layers. And so here's the definition of planetary health, not only the health of our human civilization, but all the systems, the natural systems on which we depend, whether it's the food system or the transportation system, all the components of systems that we depend on. We know that the health of people is inextricably linked to the health of the people around us. Every year, except for last year, we visited Suriname with students, and Monique's organization, the Green Heritage Organization, is really front and center in that learning space, because students can see firsthand what happens to sloths and other animals when you damage the ecosystem. So our civilization really not only depends on our health, but on the flourishing of natural systems. The interdependence of both biodiversity loss, pollution, climate change, and the mismanagement that we do, yes, it's our doing, of freshwater resources, including and specifically ocean systems, is significantly under pressure. And we can do something about it because we are doing it. We are the cause of where we are with each of these challenges that we're facing. So here are some examples from the Lancet of how we damage the planet and how in turn that damage impacts human health. Whether we talked about climate change, the loss of biodiversity is a very pressing issue because by doing so, for example, we have fewer and fewer fish species as a source of protein for us collectively, and particularly in Suriname and Guyana. The malnutrition that we're facing in Suriname, particularly in our interior population, and I will recognize him later, but definitely recognize the PI of the study in Suriname, my counterpart, and my partner in crime, so to speak, Dr. Wilco Selmans. And as a pediatrician, he really recognizes and sees a lot of that undernutrition and often recognized as anemia, or coming to the surface as anemia. Water use, Suriname might have a lot of flooding to deal with, as does Guyana, but we will be facing a water shortage globally, and much sooner than I think people really realize. And then in both countries, and really in the Caribbean wide, we're seeing degradation of our soil that we need to grow our vegetables and to feed our plants. And so bringing all of those together with planetary health in the middle, and the changes that we're making to landscapes if we cut down our forests, so deforestation, the impact of deforestation in turn on biodiversity loss, and in turn the impact on changes in our climate to planetary health, the health of people as well as the health of animals. And we are encroaching on animals' health. We are going into their territory, into their habitats where they live, is considered one health. So you see that planetary health, within which ocean health fits, is a complex relationship of systems. So what is it about climate change that we're so worried about, and particularly regional climate change? It's here and it's now. Whether we see rising temperatures or we see sea level rise, we know that what the impact will be is on human health, from periods of drought, from unseasonal rainfall and floods. I know that it rains a lot more in Suriname. For example, when I was growing up as a child, we know we had 4 seasons, right? The small rainy season, the large rainy season, the small dry season, and the large dry season. And now most seasons are just flowing into each other, and there isn't that real demarcation anymore of 4 distinct seasons. And so all of those impact what we do, the availability of food, the way we behave, the way we built our homes, and the way, as I read recently, in Suriname, where repeatedly homes were flooded. And so what is the environment, and how do we look at the environment? Often people think that the environment is only related to the things that we see, or the things that we can touch, such as the transportation or the built environment. But there's a whole other environment out there that's the ecosystem, as we talked about. Then there is the social environment. Disruption to that social environment really leads to family dysfunctioning. And then we have both challenges exist both in Suriname and in Guyana and in other Caribbean countries in the area of policy, particularly the absence of policy that's aimed at protecting us, the community. With respect to ocean health, here is a concrete example. There are policies that govern that part of the ocean that's part of a country, and if the country has policies. But there is a wide part of the ocean that is not governed by any specific country, but that's governed by at the United Nations level. There, all of those policies are voluntary and not mandatory. And so the impact on policy on what we do, on our risks and our threat is critical. And so we do not have the luxury to sit on the sidelines when it comes to policy development and enforcement. So now, what about ocean health and how does climate change relates? We talked about sea level rise. Then there is the rise of the temperature of the sea surface. There is definitely both in Guyana and in Suriname, saltwater intrusion and changes in salinity, and some of the greenhouse gases and contribute, or a portion of the greenhouse gases and the increase in those gases contribute to ocean acidification. All of that together impacts where we live. And you might say, well, ocean health is far away from us. The Atlantic Ocean is not so far away from both Suriname and Guyana. And so what happens in the ocean directly impacts our health. So here are some examples of threats in the Caribbean. Clearly, tourism, and particularly beach tourism, marine and terrestrial life, and I talked about biodiversity before. Health risks, not only to tourists, but also to locals. The damage to tourism, and I recently read an article about in the rise of tourism both in Suriname and in Guyana. The damage to the infrastructure of tourism it is a major economic pipeline that both countries would want to have. And so it becomes very critical to make sure that we keep the impact on our oceans at bay, so that, no pun intended here, so that we can continue to develop this as an economic area for the countries. So when we looked at where some tourism vulnerability hotspots are, you could see the blue circles, and let us focus on South America and a bit on particularly on the Guianas and Suriname included, as you could see on the top of that left lower solid blue circle. You really see that the challenges there, they identified as increase in extreme events, and that's true, whether it's flooding or drought. Land biodiversity loss, both countries are currently experiencing that. Marine biodiversity loss, and we talked about that, as well as travel cost, increase in travel cost from mitigation policy. So we are facing collectively as countries, we are facing those threats, and yet we're not doing much about it. And therefore losing an economic pipeline. So we had Suriname, for example, had that flood event in 2006. It was several $1 million in plant loss, and just overall, a $6 million loss. We see increases in temperature and sea level rise, as I mentioned before. The climate is getting wetter. But what often people don't remember or see or recognize is the decrease in nutritional value of our crops, of our fruit and vegetables, because of higher carbon dioxide levels, higher CO2 levels. Hurricanes exist in the Caribbean, and for example, Hurricane Irma really destroyed all of Dominica's agriculture. And 25% of the population there depends on agriculture. And so you could see how what is actually a natural phenomenon, you would say, a natural disaster, a hurricane, is influenced by regional climate change. Fisheries, coastal erosion is happening in both countries. I'll red tide, it's called, algae bloom. Marine disease outbreaks are happening when I bring the students and we visit with Monique's, on the Monique's leadership with the Green Heritage Fund, and we go and see the dolphins. We're amazed of what they're doing and in awe of what they're doing, but we're also worried about their health status. The decrease, the impact of ocean acidification on shellfish, both decreasing in size, but also decreasing in numbers. And so you could see people who are fisher folk are immediately impacted, and therefore their families are immediately impacted. And what comes on the market becomes much more expensive. Losses after hurricanes, losses, as I mentioned before, in fishing households, those are real. And so we don't have to debate whether the science around climate change and the impact of climate change on the Caribbean is something that is far away from us and it's not immediate. It's here. And so if we look at the interconnection then between climate change and human health and overlay that with ocean health, we see that there are a number of environmental impacts to your left, that the light green box to your left. And there are things that we, to some extent, have under control, and in another way, are part of our social behavioral being on the right. People who have, for example, have pre-existing conditions. People who have lower education, people who live in poverty, people who have less access to care, and particularly where a health infrastructure is challenged. All of those things come together to exacerbate, to make worse the impact of climate. And so ultimately what happens is that we're seeing heat-related illnesses, and particularly people who already have heart problems, so cardiovascular problems. We're seeing more and an increase of food, water, and vector-borne disease. And increasingly, we're seeing more mental health impacts. And I want to stop for a minute and talk about those. Mental health impacts will be with us longer, have a much more profound impact on overall health, and have the least attention across the world, regardless which country we live in. And so I want to single out the mental health consequences of what we do to our oceans, what we do to our climate with respect to human health. So again, if we look at climate change and human health, there are both direct effects and indirect effects. And again, I am also going to do that towards the end, but want to acknowledge my colleague, Dr. Abdul Wahid, who really is the co-designer of my presentation and who I jointly represent here. His work on climate change, particularly in the Caribbean, is very significant. And so this is an adaptation that Dr. Abdul Wahid did from the work that my colleague here in the US, Jonathan Petz, is doing, to looking both at direct effects and indirect effects. Again, I want to point out the direct and indirect effects in the middle, but truly focusing on the two boxes on the right, where we see injuries and death from flood and landslides. We see heat stress and cardiorespiratory failures. But we also see increases in cases of malaria and dengue. And and increasingly population displacements in the US as well as in the Caribbean. I use this slide often when I teach climate change because we won't have time today during the presentation, but I encourage you to think about each of these four inner circle dynamics: extreme weather, sea level rise, increasing carbon dioxide and rising temperatures, and then go to take that ray of effects outward. And so, for example, we could look at more extreme weather gives us changes in vector ecology and where the mosquitoes live for the most part, and then the impact on all the vector-borne diseases. And so it doesn't matter which ray you take, which slice of the pie you take outward, it impacts our health. And so I now want to drill down to the chemical stressors, the chemicals that are in a place where they shouldn't be, where they don't belong, or are present at levels that might make us sick. And there are different kinds of chemicals, and I will not focus today on the nuclear and the radiological ones, but really on the chemical piece. So revisiting and emphasizing what the environment is and what it means and how it impacts health. The chemical environment, those are the pollutants, the toxic waste, the pesticides. That's part of our study that we're currently conducting in Suriname. But then we have a whole host of biological agents, right, in our food and water. I also want to, just like I did with mental health, I want to take a minute for us to focus on noise. When I last visited Suriname, and when it's hot, people have their windows of their cars open. Although I love music, I was enjoying their music as well. Although they didn't have it on the speaker or the radio, it actually was piping into their ears. And so noise pollution is real. Not only will the person, become hard of hearing and basically deaf when they reach 50, and I'm talking to the young people now, but it is a pollution for everybody else. So noise is equally concerning pollution as it is any toxic chemical. And then the impact, as I talked about, the socioeconomic impact of housing, safe housing, housing that is free of contaminants. So now all these chemicals are out there, but how do they get into us, and what is it that we call exposure? So at some point, we either swallow, breathe, or the contaminants or the chemical is on our skin and it comes in. And we could be exposed for a very short time, like when you are going to get gasoline at the service station, or for a little bit of a longer time, around 90 days, or for a very long time, multiple years. It is that very long time piece that we're often worried about chronic diseases, including outcomes such as cancer. And so exposure is really a way for us to get in contact, for people to get in contact with a chemical, and for some kind of change to happen in our body. So how, again, back to how the chemicals can come into us. That's in environmental health, we call that a completed exposure pathway. So we know the contaminant source. Let's say it's pesticides that we're spraying, or mercury that we're mining, that we're using in the mining area for gold mining. It has to travel through some taxis. And those taxis are what we call environmental media. They could be soil, they could be water, it could be air. And then there is a place, a point where we come in contact with these chemicals. So that's called the exposure point. And then there is a way for those chemicals to come into our body. That's the swallowing, the drinking, the breathing, the going through our body, our skin kind of way. That's exposure route. And then lastly, people have to be there, right? If people aren't there, then people aren't exposed. So this logical way to think about how chemicals come into our body is very important for a number of reasons. But it's particularly important that we stop it be above any of these 5 contaminants. So if we can stop there not to be contamination, there not to be chemicals, whether it's in our water, in our rivers and particularly in our oceans. If we can stop that, none of the rest will happen. That's my key message today. And so here are some threats that both countries face with relation to ocean health. We talked about deforestation, but particularly the loss of mangroves. I've seen that every year that I visited Biggie Pond in Nikeri, where it is not only visible, but you see the damage also be visible. The threats to our agricultural industry because of the use of pesticides. We talked about mining, the use of mercury and cyanide. And then to be coming, I know that both countries are very positive and optimistic, and so am I, for the development of the oil, and oil being available as an extractive industry. I think if both countries do it well with the correct policies, we can protect people and the environment, and then everybody wins. There's an economic pipeline, but in a way that is safe for the environment and safe for the people. Not only the people who work there, but the people who live around it. And then we talked a lot about, in the past, at least with my students, to talk about where we put our trash, where we throw our trash, what goes into our trash, and particularly what we do with our plastics. There are coming from plastics and other sources, and particularly dumping in oceans, chemicals that are forever with us, that will never go away. And so the sooner we stop dumping those, the fewer of those chemicals will be with us forever. So a little bit more specific, let's take the pesticide cycle. We spray the pesticide. It's taken up by a plant, a vegetable, or a fruit. But some of it also goes into below the root into the soil, and it helps to deal with bacteria or viruses or the things that we want to make sure our plants and our vegetables look nice and green and easy and beautiful and have no holes in their leaves. But some of those pesticide particles actually stay in the soil. And when they stay in the soil, and there is surface runoff, they actually can get into our surface water, whether that is a creek, a lake, a river, or an ocean. And it can then in turn contaminate our fish, and we eat the fish. There are other ways that pesticides can get into the ocean by being taken up if there is evaporation, meaning it goes up into the atmosphere and it rains and it comes down with the rain. And so you could see that whether you are, looks like a pelican or some kind of bird there, whether you are a bird or you are a sea mammal, you don't have much choice in terms of pesticide contamination. And if we are at the end of the food chain, we eat those things, we are getting it into us. So the choice is really us to create a safe environment. Now let's take the mercury cycle. Mercury is used in many areas in Suriname, for example, to mine gold, but not retrieved. And so it ends up in the rivers, in surface water, and goes and sits because it doesn't necessarily, it's not a volatile organic, so it will be evaporation, but there is not volatilization. Kind of difficult words to say. It's going to sit in the mud, in the clay, and the little creatures eat that as their food, and the little creatures are consumed by little fish, and the little fish are consumed by big fish, and we catch those big fish, and then we eat those fish. And so that's where the worry is coming from. Same thing goes for plastic, and that's the worry we most have because, as I mentioned to you, from an ocean perspective, the dumping that occurs where there are no policies because it's in the middle of the ocean, and so those pellets, those plastics will be there forever, and will be a threat to human and animal health forever. So switching and going even smaller, I mentioned to you and Monique mentioned the Mikita Mara study. Was a Suriname name for a very unique environmental epidemiological study that's occurring. I mentioned and acknowledged Dr. Wilco Seilmans before. There are several, I think, team members, investigators on this call and on in the conference, and I'm really very proud of them and very honored to be a member of that team. But we are this is our 6th year now, following almost 1,200 women, and they are from the places that you see here numbered. So both from the interior in the capital as well as from Nikeri. So 3 regions. And what we're looking for are exposures to mercury, other metals such as lead, and pesticides, and the impact on that exposure during pregnancy. So these were pregnant women back then, on their infants, on the babies. We have some data now, and some I'll talk about, some we are still working to analyze, so we don't have all the data analyzed yet. But we're worried. And so these are all exposures that we can prevent. Remember, I talked about if you prevent it at the source, we don't have to go through that exposure pathway. And so here's some of our worry, and you don't have to be an environmental health scientist to understand this. If you see at the first graph, you see the dotted line that goes horizontally. And you see the yellow bar that is way above that dotted line. And so overall, in some locations, we are very worried about the high levels of mercury above levels that would be of concern in the pregnant women back then. Similarly, for lead, continue to look at that that yellow bar. These are our interior women, where that dotted line is, the yellow bar is above that dotted line in terms of lead exposure. Sorry. And then, but there's potentially some good news. Selenium is a good metal that will help us, and that has a lot of health benefits. And you see there, the yellow bar is very high. So there are the women in the interior, at least the small number of women, this very small number of women have that metal in their blood that might, we don't know that yet, but that might help a little bit with the mercury and the lead as well. And then you see some other chemicals also. I want to point out that cadmium, manganese, and tin represent a part of some pesticides. And so you could see that some of those are elevated in Nikeri, while others are elevated in Paramaribo. I know that many people in the capital of Suriname have their own little garden, and that shows in terms of the use of pesticides. So we talked about what biodiversity loss does and what contamination does. So here again is a very, very little data that we're beginning to see in terms of what mercury can do and where mercury accumulates. Remember, I shared with you that it goes to sit in the mud and then little creatures, planktons, eat the mud, and then the planktons are consumed by little fish, and the little fish are consumed by the big fish, and we eat the big fish. So what are the big fish that we're eating? If you look at the freshwater species, you see that those are the Anumara and the Tucunari and the piranha. Those are relatively higher in mercury, as you could see, than, for example, the fish that we catch in more in the marine area. But here too, there potentially might be some good news. Again, too little data to say that, but you can also see that omega-3, these are I take omega-3 tablets as a supplement to my diet. So that's the good kind of fatty acids. We see that the freshwater fish have some amount as well, but the marine have a bit more. But if you look at selenium, remember we talked about this essential element that is good for us. You see that the freshwater fish have a good amount of it. So we don't know yet whether this will be helpful, but we're most worried about the freshwater fish and where mercury is contaminating those fish. But those are, I mentioned the names to you, the most popular fish that many people eat. Same story goes for pesticides. For pesticides, you don't measure the whole pesticide. This is in urine, but you measure it parts of the pesticides as the body deals with it. And you could see, and these are different kinds of 6 different kinds of pesticide groups or families, and you could see that you have some increased levels in Ikeri, but also some in Paramaribo. So here was my attempt 2 years ago now almost, to begin to talk about what we're seeing, and just as what I shared with you. And Ikeri has always been so welcoming to be able to share, and so I really appreciate every visit I make to Ikeri. And so when we look at pesticides and we look at mercury, what does it have to do with climate change? In addition to we putting it on plants and pesticides and vegetables, we see that whether you take the higher temperature, the route, or you take less rain or more rain route, however, whichever route you take, we end up with more of the pesticides staying in our produce. And so I want you to think about this. Similarly, whichever route you take, whether it's higher temperatures, less rain, more rain, stronger winds, ultimately, we are worried about not only the amount of fish that is available to eat as a sort of protein, but the amount of contamination in those fish. I bring you back to where we started, because now I'm hoping that it makes a lot of sense, or at least more sense, to why I'm saying that each of these circles, from planetary health to climate change to environmental health to disparities, all of those encompassing ocean health, is a burden on our communities. And if all of this, a part of this is, but if all of this was from nature, you might throw your hands up and say, well, there's nothing that we can do. It is what it is. It's coming from nature. But I would say 99.9% of this is what we do ourselves. when we contaminate the oceans and we contaminate the rivers and we contaminate the soil and the water that ultimately we drink and the babies that we grow in us, the women, we're doing it to ourselves. And so this conference is important. It's important to me. It's important, I know, to all of you as a call to action. We have got to stop doing this because the health of our community is truly, whether it's a community in Suriname and Guyana or the Caribbean or the world, is in our hands. We make those decisions. We develop those policies, and we throw those policies out of the door if they don't fit us. And so we have difficult decisions ahead, but I have every confidence that we can do it. I'd like to end and leave some time for questions. But before I do that, I wanted to paint that picture for you of how what we do as scientists actually can be used and should be used. So what we do as scientists, it has no meaning. All that I talked with you about have absolutely no value or no meaning if we don't translate it into evidence-based policy. If we don't let the data and the science influence the policies that we make in our countries, in our respective countries. And that goes for any country, not only Suriname and Guyana, or countries in the Caribbean. It goes for the country where I currently live and the countries around the world. Similarly, if we don't use the science to make sure we give people the tools to take action, then specifically, if we don't use science to inform the practice frontline, then science is also useless. And so science is only as important as the ability for us as scientists and the responsibility for us as scientists to translate those into policy and to take action on the front line. And now I'm really going to stop, but not before I recognize, and this list could be twice as long, all the partners and the investigators for the CREO team for the piece of the research that local research that I presented to you. So let me stop sharing and be available for questions.
Yes, so thank you, Dr. Lichtveld. I'm trying to see if there are any questions. Not yet, but of course your talk is so important, and it's so important to see that in this conference we're in, we first had this perspective from a purely marine science perspective by Dr. Moore. Then we had the youth panel, and I actually would ask our youth panel if they do have any questions for you. And now you're shining your light on this problem of ocean health and human health and how it's all connected from a public health perspective. And I also went to the youth panel. I went to the Dr. Trout's panel, so I was switching a little bit in between. And what I noticed is that everybody's basically saying we have to do something. So why do you think it is that we are not doing anything?
We are not taking action because we still need to increase awareness, one. We're not taking action because we don't necessarily put our money where our mouth is, i.e., fund the things that we must do because they're not, and I'm going to use a very unscientific term, because they're not sexy. We're not buying a new building. We're not christening a new, house. There's no photo opportunity for me because what I do in public health is not necessarily sexy. And we're not taking action because the political will is not there. And that perhaps of all those reasons, that's probably the most difficult one to overcome.
But when you say political will, what do you think about industrial and commercial interests? Because I think that is something also that shapes the way we interact with our world, isn't it?
It is, but as an environmental health scientist, you probably will be surprised to hear this from me. Industry must be a partner in these conversations. We cannot do this without industry. And so having industry at the table is as critically important as having policymakers at the table, having communities at the table, having organizations, social organizations at the table, having academia at the table. And so there must be a place for everyone, and it will require everyone's participation to make this happen.
Yeah. So, yes. Okay. So there's this how shall I say, we are torn then, isn't it, between not liking the industry, saying, oh, I don't want to work with them, and actually you're saying we have to work with them because otherwise there's no solutions. But how can we, as the Davids of this world, engage with the Goliaths, like, those big multinationals who really don't care about us in this state? That's at least my impression. They just say, oh, well, that's, crazy activist again. We just ignore her.
My experience has been quite positive, but we just need to take time to do that. Obviously, the industry is there to make money, and each of us are engaged to make money, right? I work to have a salary so that I could, provide for my family. But there is a component in every industry, including in the oil industry, that either is called government relations or community relations or something like that. That group really is setting aside funds to develop and support community projects. I have such a project going on while I'm now in Pittsburgh, still on the Gulf in Louisiana, where funds are made available to train high school students, juniors and seniors in high school, to in environmental health, and then look at their trajectory into college. And I'm very pleased to say that about 92% of those students, after spending only 3 weeks with us at the university, end up in college, and some of them are soon graduating as physicians. And so it's possible to work with industry, but it is finding the right path within those big companies to have that conversation. But there are funds that are specific for community development projects, and that's true for both Guyana and for Suriname. And that, in fact, in Guyana, because I am connected with what's going on there, you're probably closer to begin to have those conversations. And so I hope that the Guyanese leaders will take up that conversation with industry.
Yeah. Okay, so we do have a question for you from the question from somebody in the audience. And it is, would you please explain some more on the mercury and selenium interaction?
Yes, thank you. And so here is a concept where science hasn't worked it out completely, but here is at least a thought. And I really need to acknowledge my colleague, Dr. Jeffrey Wycliffe, who's part of the team who's working on this. We know that selenium is good for us. And if you look at your multivitamin bottle, if you buy multivitamins, you probably will see selenium listed there. It's an essential element for a number of functioning areas in our body. So we know that's good. We also know, on the other hand, that mercury is bad, right? I mean, it doesn't do any good in our body. And so could there be the fact that in some of our women, we see high levels of mercury and high levels of selenium? Could those two cancel each other out, or could the fact that there are high levels of selenium decrease the impact of mercury? We don't know that. We don't have enough data to show that, but it gives us at least a little bit of not comfort, but a little bit of hope that those high levels of selenium might help us with helping the body to counter the impact of mercury. But so what I'm not saying, and I'm glad that question came up, is it's okay to eat all the mercury in the fish that you want. Just take 2 pills of selenium and you'll be fine. That's what I'm not saying, because I know how some things can be translated. That is not the case. We're simply having an observation that in some women we see high levels of mercury and selenium. So the bottom line public health message is mercury is not good for us. It's not good for the fish. And it's certainly not good for people, and it's definitely not good for our babies, because what I didn't share with you, because the data are really not well analyzed yet, is that we are seeing very early on in babies who are now 12 months old, and we're continuing to follow these babies, that we're seeing some impact of the mercury exposure in the mom in the development of the kid's brain and of the kid's neurocognitive is a big word, development, so the kid's neurodevelopment. So we are seeing that the impact of mercury exposure is not only in the adult, but it's also in the baby, in the fetus, and it's in the baby as the baby becomes a young child. And so we're following the young children. Now we're at year 3. And so the decisions we make, thank you for letting me make this point. The decisions we make today might have an impact of generations to come, and perhaps generations before this mom. So the grandmom or even the great grandmom. And so it is really important for us to think about what we're doing when we're poisoning the environment, whether it's the ocean or the river or a lake or the soil.
Yeah. Thank you for making that point, because it's so important to make this connection about what happens in the river is actually also going to affect the ocean. But in the end, it's going to affect not just us at this moment, but it's going to affect generations to come. And I think that's a really important point. Yes. So I don't think there's any other question. So I would like to thank you. This was amazing. I hope we can continue collaborating with you on and with your team on highlighting the results of your research, because I think it's really important for Surinamers, but also Guyanese and other people in the Caribbean, to understand how the way we use products is going to affect and the way we produce as well is going to affect us and the generations after us. So thank you once more, Dr. Lichtveld. It was a pleasure having you. And this video will be made available. Your presentation will be made available on our YouTube channel, so people who were not able to watch it can watch it afterwards. And I would like to invite everybody now. We have 1 hour left to visit also the Mickey Tamara booth to know more about this project and about the outcomes that were, the results that were still going to be made available. And also Other booths, we have an enormous amount. We have 13 booths. There's actually one booth. There's a competition by DP World, so please visit the booths. We have 1 hour left in this. I really love the conference. In this conference, so I would say go to the expo, do some networking, just meet some new people. And Dr. Lichtveld, once more, and all other speakers and everybody who participated, thank you very much for being here. And we hope to see you soon again. Thank you.
Congratulations on the conference.
Thank you.